Good. So this presentation today will share information about Ohio's Help Me Grow program. Help Me Grow connects families to a network of information and resources so children and families thrive. Oh. Help Me Grow understands that a child's early experiences influence brain development and create the foundation for success. Help Me Grow promotes positive outcomes for pregnant individuals, supports child development, and empowers families like yours. Help Me Grow offers developmental screenings, community resources, newborn home visiting, ongoing home visiting, and early intervention services to support healthy births and give all children the best possible start in life. With central coordination and intake and referral, a single point of entry makes every door the right door to services for families with young children. Now let's dive into Help Me Grow services to which central intake connects families. The first service we will cover is developmental screenings. Help Me Grow offers free developmental screenings for all Ohio children through age 5 with the Ages and Stages questionnaire. The Ages and Stages questionnaires, commonly referred to as the ASQ, is a screening tool for young children. The ASQ is a formal research-based instrument that asks questions about a child's development. These include language, motor, cognitive, social, and emotional development questions. This tool accurately identifies children at risk for physical or social emotional developmental delays and will help indicate if further evaluation is necessary. It is available in English, Spanish, Chinese, French, and Arabic. The Sparkler Play for Parenting app allows families to complete the ASQ for their children to track developmental milestones as early as 1 month old for free. The American Academy of Pediatrics recommends that children be screened at 9, 18, and 30 months and up through 5 years of age. Sparkler sends parents reminder notifications through the app when it is time to complete a new screening. Sparkler is a mobile app that is available on both Android and Apple platforms. You can use the app to, again, complete the ASQ 3 or ASQ SE2, which is the social emotional ASQ, to track your child's development. Access activity libraries and evidence-based developmental tips for parents. Connect with partner providers, such as your child's daycare and pediatrician. This will allow families to chat with the providers to best support your child's growth and development. Ohio families can access these free tools using the access code OH. If a family's medical or child care provider is a Help Me Grow program partner, they will provide a unique code for the family to use. If a family cannot access Sparkler through the mobile app, a developmental screening specialist will assist with completing the screening over the phone. So what happens when a family takes the ASQ? Well, the family completes and submits the ASQ within the Sparkler app. Scores are immediately calculated, and Sparkler creates a family-facing report for the developmental screening specialist to review with the family. Central intake and referral, and any connected providers are notified that an ASQ has been completed, and they can view the results of the report. A developmental screening specialist reaches out to the family to discuss and share the report. During this call, they will also offer referrals and outside resources. The developmental screening specialist completes a follow-up form based on their discussions with the family. This form can be viewed by program partner providers in Sparkler. After the follow-up form is completed, the family receives the ASQ summary report via email. This is a copy of what the ASQ 3 would look like. Now, another way Help Me Grow supports families is through newborn home visiting provided through Family Connects Ohio. Family Connects Ohio, or FCO, is an evidence-based nurse home visiting model that provides support for all families with newborns within participating communities. FCO nurses will nurture the whole family and support a newborn's health and well-being. This evidence-based program has no income requirements for families. Family Connects Ohio offers all families in FCO communities a nurse home visit around 3 weeks after the family brings their baby home. All families, including adoptive, foster, and bereaved families in FCO communities, are offered a home visit with a highly trained registered nurse at no cost to the family. There are 4 basic components of a nurse home visit. The first one is assessment. A highly trained registered nurse conducts a physical and mental examination, discusses health history, and checks infant vital signs and weight. Education. Topics covered include infant care, safe sleep, pelvic floor health, postpartum emotions, and household safety. Lactation support. Discussions on positioning, latching, increasing supply, pumping, and bottle feeding. Referrals. Nurses connect families to healthcare and childcare providers, WIC, early intervention, ongoing home visiting, and other community resources. A Help Me Grow staff member will follow up with the family in a few weeks post-visit to see if referrals were helpful, if more referrals are needed, and to see how the family is doing. For the latest information about Family Connects Ohio, please visit our website, helpmegrow.org/Family Connects. Now let's talk about ongoing home visiting. Home visiting is an evidence-based service that provides expecting parents and caregivers of eligible children with supports to raise children who are physically, socially, and emotionally healthy and ready to learn. Any pregnant individual or family with a child under age 3 can be referred to home visiting, including new parents, foster families, and kinship caregivers. Income requirements may apply. Central Intake can let families know what services are available in their community and can connect them to the services that meet their needs. Now, what do home visitors do? Well, home visitors provide support for a healthy pregnancy. They conduct health, developmental, environmental, and relationship screenings, deliver education and information about early childhood growth and development, and positive parenting practices. They also facilitate enjoyable parent-child interactions and help families set goals to promote self-sufficiency that is parent-driven and family-oriented. Our home visitors also acknowledge and celebrate child and family successes. Home visitors collaborate with other service providers working with the family, such as early intervention service coordinators or job and family services caseworkers. They also connect families to community resources and assist with transition planning for the children and family to the appropriate settings, such as preschool or a childcare setting. There are many positive outcomes from home visiting for participating families, including improved maternal and child health, better school readiness, greater economic self-sufficiency, reduced juvenile delinquency, family violence, and crime rates, increased connections and referrals to other social services. The U.S. Department of Health and Human Services has a website that has many studies that support these outcomes. For more information, visit homvee.acf.gov. Let's talk about how home visiting makes an impact. Now, the one-to-one support of a home visitor offers families a trusted resource for information that will help the children thrive. As you are likely aware, the infant mortality rate for Black babies in Ohio is more than double that for white babies. Home visiting can address many of these issues that contribute to this disparity in outcomes. From making sure pregnant individuals are connected to prenatal care, to making sure families have resources to help them prepare for a new baby. Even after the baby is born, home visitors can help with common parenting challenges, like feeding issues and safety at home, including safe sleep, which can prevent infant deaths. The information parents receive from their home visitors is reliable and evidence-based. From managing children's challenging behaviors to understanding a child's development, Home visiting offers evidence-based tools and strategies to help families develop positive relationships that reduce the likelihood of abuse and neglect. A trusting relationship with a home visitor allows parents to get answers to their parenting questions and navigate challenges in healthy ways. Many low-income families are living in difficult circumstances, like homelessness, extreme poverty, incarceration, and addiction. Home visiting can connect these families to reliable information along with resources within their communities. Families receive support, encouragement, and reliable information from their home visitors. The quotes on these slides show how important home visiting is for families. One family stated, "These years are so intimidating, exhausting, and it's nice to have someone to talk to. And you say you're not the only one. It's a very real relationship." Another family said, "I had no help of my own, so it has been so helpful to have a home visitor teaching me what to look for." While another family added, "You don't get a lot of time in your doctor's office. You think you will, but you don't. And it's nice to have someone to bounce ideas off of." And finally, one family said of their experience, "It's an incredible service to help prenatally and after. My visitor was a guru during pregnancy and turned into a therapist and everything in between. They're here to talk to. They help beyond just the kid and the program." So now let's talk about early intervention. This is also a part of the Help Me Grow system of supports. So what is early intervention? Early intervention, or EI, provides coordinated supports to families of children that have children birth to age 3 who have developmental delays or disabilities so that they have the best possible start in life. In Ohio, the EI fulfills the Federal Individuals with Disabilities Education Act, or IDEA Part C, program requirements for infants and toddlers with disabilities. EI is a partnership with families to support a child who has developmental delays or disabilities. EI professionals support the families to identify a child's strengths and needs and address concerns as early as possible. So, who should be referred to early intervention? Family whose children have a medical diagnosis affecting their development or developmental delay, as well as families who suspect their child might have a delay, should be referred to EI. Many diagnoses automatically qualify for a family for early intervention services. Some examples of conditions include extreme prematurity, very low birth weight, NICU stay greater than 30 days, hearing loss, neonatal abstinence syndrome, neonatal opioid withdrawal syndrome, or elevated blood lead levels. With documentation from a healthcare professional, there are other diagnoses that can also make a child eligible for EI. However, a child does not have to have a diagnosis to be eligible for early intervention. If there is a concern that a child may have a delay or disability, it's important to refer them for EI as soon as possible. Screening and eligibility determination are always free. Once a referral is made, professionals with expertise in early development will conduct an evaluation and/or assessments to determine if a child and family are eligible for services. If so, they will support the family in addressing the child's specific developmental, physical, social, and emotional needs. EI can have a powerful impact on a family's life. This quote comes from a family about their experience. "The entire program worked wonderfully for our family. They were so attentive and aware of both my son's needs. The exercises and practices we learned through early intervention have dramatically changed the quality of my children's lives, and I am so grateful." So, where do early intervention services happen? It's important to understand that EI services are not the same as clinical therapy. EI typically provides services in a child's home or childcare setting in the context of everyday routines based on the family's priorities. The location would be determined between the family and provider. EI services can be provided side by side with other services the family receives in their community. EI is available to any eligible child in Ohio. Again, the referral and eligibility process is free and it is not based on the family's income. Any child anyone can refer a child to EI. In fact, families can self-refer their child if they have concerns. It is not necessary for a doctor or a teacher to refer a child. Anyone can do it. All it takes is a simple phone call or a few moments online to fill out a short form. Families often have concerns about how their child is developing compared to other children their age. A child might demonstrate difficulties with behavior or playing with other children. EI can help families develop routines and that support the family's social, emotional development and positive social interactions. A child who is experiencing a speech or communication delay might not babble or talk like other children and may show signs of frustration. EI can help the family learn how to provide more opportunities to practice speech and communication. For a child who is not crawling, rolling, or walking like their peers, EI can help the family figure out why their child's motor skills are delayed. EI can also assist a family with adapting to the home environment in ways that provide more opportunities for movement. The developmental areas shown in this slide are just a sample of delays EI can address, but EI serves children with all types of developmental delays and disabilities. This quote comes from another family about their experience with early intervention. The ability for our son to engage in therapy in the comfort of his own home has been such a big help. It was great to be able to see how different therapies actually worked for us in our own home with things that we already had. The final resource I want to discuss with you guys today is the Help Me Grow Community Resource Directory. This is an an online catalog of early intervention, home visiting, and family support services in all 88 counties. With the Community Resource Directory, families and professionals alike can search by location, service area, tag or keyword, interact with the map's listings on both desktop and mobile, share provider listings via email, text, and link sharing, easily submit your organization to be added to the directories. Our directories capture a variety of early childhood services and resources available in Ohio. Directory categories include breastfeeding and lactation support, early care and education, cribs and safe sleep, physical therapy, assistive technology, occupational therapy, career development, county services, parent groups, doula services, specialized healthcare practitioners, early childhood mental health, fatherhood resources, speech language pathology, food and nutrition resources, lead prevention resources, pregnancy loss and recovery, birth to 5 supplies, and much more. You can access the directories at helpmegrow.org/directories. With the community resource directories, families and professionals, we got stuck. Sorry, guys. The web referral form makes it easy to connect with families to all the services we discussed today, plus WIC. A Help Me Grow staff member will contact the primary caregiver within the next business day to confirm any interest in any of our services. If you would like to learn more about Help Me Grow services, please visit helpmegrow.org. The Help Me Grow website includes family-friendly information about all of our services. Providers can also use the community resource directories and find contacts for each region of the state on the Help Me Grow website. Now that you've learned more about Help Me Grow's system of supports and referral processes, hopefully you are ready to refer and are more comfortable with the process. Remember, when you refer a family or child through Help Me Grow, you do not need to know what program the family is eligible for. Just refer. Don't wait and see. Thank you guys so much for letting me meet with you and present to you. Do you guys have any questions for me?